Hi, everybody. Thanks for joining us for our continued series on our community connections in response to the COVID-19 crisis. My name is Brooke Smith. I'm the CEO at United Way in Lebanon County, and I'm happy to have a friend of mine and a colleague, Stephanie Andreozzi, here from WellSpan Good Samaritan Hospital. And Steph, do you want to just share what your title is at the hospital and kind of the role that you're playing in this COVID response?
Sure. I'm the Senior Director for Clinical Services at WellSpan Good Samaritan Hospital. In my traditional role, I oversee a lot of our non-nursing clinical departments, particularly our cardiovascular service line and our pulmonary services. But for the last 2.5 weeks, WellSpan Health, as well as WellSpan Good Samaritan Hospital, has activated what we call our Incident Command, which is our response to the pandemic for COVID-19. And I've been serving in that incident commander role, supporting our team and working through the objectives as we plan our response.
Great. Thanks for being with us. So this is a little different from our other interviews in the series. This will be recorded because Steph's schedule changes by the minute. So thank you for being here with us today. Certainly the news is ramping up, and today the governor just announced a stay-at-home order for the entire state of Pennsylvania. And so as we see this creep into Lebanon County and our, central PA area, if people are experiencing symptoms, Steph, what types of things do you want them to know?
I think it's really important first to know what those symptoms are that we're looking for. The most important symptom really being fever, but we're looking for fever and cough or shortness of breath. Okay. About 80% of patients who have those symptoms will experience a mild response and can safely manage those symptoms at home. We ask that you contact your primary care provider over the phone to discuss your symptoms. If you don't have a primary care provider, you can take advantage of an online urgent care visit, or you can call WellSpan's coronavirus hotline at 1-855-851-3641. I think it's really important to recognize that WellSpan is waiving all out-of-pocket costs for COVID-19 testing and treatment. So even individuals without insurance or with high deductibles should not see that as a barrier to getting the care that they need. We're asking that you contact somebody through a virtual means, whether it's over the phone or online, to determine next steps. And that provider will really help you know whether you do need to get tested for COVID-19. If so, WellSpan's got a series of more than 10 testing sites across the central PA region. We do have testing sites here in Lebanon, and it's important to know that you do need a physician order in order to be tested in one of our outdoor testing sites. So please do not just show up at the tent without talking to a provider. We are asking that people not go to the emergency department unless they're having a true medical emergency. If you do have symptoms, it's important to stay home, self-isolate, do not go out in public, do not be around your family members, your friends. We want you to disinfect things at home and make sure you're washing your hands often. People ask the question about how long they need to self-isolate if they do test positive. And there's some general guidelines out there that speak to a 14-day self-quarantine period. But it's really important that you work with your provider to understand your specific time period, because they take things into account related to symptom onset, how long you've been without symptoms, particularly how long you've been fever-free, as well as improvement in your cough and shortness of breath.
Yeah. So some really important messages I think I heard in there. I just want to reiterate: do not show up at the hospital. Do not show up at a testing site. People need to be contacting a physician or your hotline to get an order to be tested, correct?
Correct.
Great. What would you say is the couple things, and I think you did share a few, what can we be doing as the general community at large to help stop the spread? What types of things do you want to reiterate that people know about?
Yeah, there's a really important reason why the governor has now issued a stay-at-home order for the entire state. We talk a lot about social distancing and the importance of flattening the curve. COVID-19 is a highly transmittable disease because we do not have immunity to it like we do sometimes with the flu or the common cold. So if we were to have a large number of people exposed all at once, the number of individuals seeking healthcare services would exceed the capacity of all of our local doctors' offices and hospitals. So staying home, staying away from people, the fewer people you come in contact with, the less likely that somebody is going to transmit the virus to you. And what we know about the virus is that it is transmitted through droplets. So things like talking and coughing and sneezing all have the potential to expose you to those droplets. And we ask people to maintain a 6-foot distance if they are going to be out in public to minimize that transmission. With that being said, those droplets come out, and if they don't hit you, they're going to hit surfaces. So washing your hands regularly, particularly if you do have to go out into public and you're touching those public surfaces like door handles, cell phones are another big culprit. You know, we don't always think about washing our cell phones, washing our remote controls, but those frequently touched surfaces become a really high risk environment.
Sure. What are some of the priorities of the health system in response to COVID-19?
Sure. WellSpan has really launched a very proactive approach to how we are addressing the pandemic. The first thing we did is we were really quick to respond once commercial testing became available with those outdoor testing sites. We've completely changed our model of care in some areas to promote social distancing by creating video visits and telephonic visits for people who still need to have episodes of care within the health system. We've prioritized our outpatient visits and some of our surgical service procedures, recognizing that now is not the time for people to be having routine screenings or low-risk procedures like colonoscopies if it's not deemed medically urgent. That just reduces exposure risk for people coming into our health system that may have other chronic health conditions that put them at a higher risk of having a more severe COVID-19 response. And then we're increasing our hospital capacity, anticipating that the number of patients who will require hospitalization and intensive care services will increase.
Yeah. You know, you hear a lot right now about people wanting to help. I think those of us that are working from home or are kind of not on the front lines of this feel helpless, and we're watching through the news and trying to be informed. And we've heard a lot about these cloth masks. And so can you speak to that? Is that something the hospital is looking for community members to be providing to your frontline team members?
I think there's been a lot of information in the media around the challenges around PPE or personal protective equipment. And so designing ways that we can create PPE outside of our normal supply chain is a great innovative response. It's important that whatever PPE is created meets the guidelines to keep clinicians and patients safe. We do have an innovation team within WellSpan that is working on a prototype and a pattern for those masks. So we would ask those individuals who are looking to help to check back onto our website frequently, because once that pattern has been approved, there will be a team looking for individuals to help with creation.
Yeah, that's great. So I do believe you have a website, How to Help, and that's where they would find something like that. I was checking it out earlier. Okay.
We do. Yeah, we do. WellSpan has an entire coronavirus section to their website, and a lot of the information that we're talking about today can be found on that website. One link in particular is entitled, I Want to Help. So there's a method to make a monetary contribution. There's a method to donate medical supplies and have them vetted by our supply chain team. We are not accepting volunteers at this time. We've actually suspended all volunteer service. But if there are retired clinicians in our community who are interested in re-entering the workforce temporarily to help with this response, there's a mechanism on the website to contact the appropriate party. The last donation that's still really important right now is blood donations. And people ask, is it safe to donate blood? We are asking people to schedule an appointment at our blood donor center. That is a safe environment where we are able to maintain social distancing, but still obtain that blood, which, the need for it just doesn't go away.
Yeah. Are you able to give an update at all on the number of cases right now in Lebanon County?
Sure. So the source of truth is really the Pennsylvania Department of Health website. That website gets updated every day at noon. So as of noon on Wednesday, April the 1st, Lebanon County has 36 cases.
Thank you. And we mentioned supplies a little bit in talking about those cloth masks. How's the hospital? Are you seeing a shortage in supplies, and how are you handling that? Maybe collaborating with community partners. What does that look like?
So I'm just amazed at the work of our supply chain individuals. They spend all day, every day sourcing vendors, looking at what we call our burn rate, or the amount of equipment, supplies, medications that we're currently going through, because these are very unique care times and these patients do have, a higher need for us to utilize that personal protective equipment. And then, as I referenced, we have this innovation team that is working with local manufacturers on PPE and sanitizer resources outside of our normal supply chain. And I think that type of innovative work is just really, really great. We are also tapping into both state and federal resources through our county EMA, up through PEMA, which is the Pennsylvania Emergency Management Association, and FEMA at the federal level to obtain personal protective equipment. All of that equipment has to be vetted because sometimes it is coming from manufacturers and it is models that we don't normally use within our hospital. And so ensuring that our teams get the appropriate training on that equipment before we put it into use.
That's great. This is such great information. Steph, thinking about kind of this pandemic in general, is there anything that we haven't talked about that you feel is really important to share with the community at large?
Sure. I think, there's a lot of messaging out there about staying well, and taking care of yourself personally becomes so important. It is normal to have a heightened level of anxiety right now. The media is full of information every day where we're seeing increasing numbers and pockets of crisis within cities right here in the United States. So doing what you can to stay healthy, to get enough sleep, to stay on a routine. It's not normal to be working from home and having your kids doing school from home and not being able to go out to eat or go to social functions. So finding ways to connect with your friends, making more phone calls. We've become such a society of text message, but picking up the phone and having a conversation, or doing a Zoom or a Skype with someone, and finding those opportunities to laugh and just get a little break and a little levity from all of the seriousness that we're all experiencing. Do what you can to eat healthy. I know grocery shopping is a bit of a challenge right now, but taking care of yourself, getting exercise. It is perfectly safe to go outside and take a walk and get some fresh air. Just make sure if you're walking with more people that you do maintain that social distancing.
That's great. And I know you mentioned it, but as we close, I want to make sure that people who want to support the health system and your efforts, as a reminder, where can they go again if they'd like to support you?
Sure. So on the wellspan.org/coronavirus website, there is a button entitled I Want to Help. It will take you to several different links for the various categories of support that people may want to offer the health system. The one area we didn't talk about was food donations, and we've had lots of people reach out and offer to bring food for our staff that are working very hard taking care of these patients in our community. Right now, that is not a big need for us. It may be a need in the future, and so we ask that people hold off on that. But if they are interested in donating, there are plenty of other community partners that accept food donations on a regular basis, like our food banks or LCCM, that would be more than happy to take those donations. The COVID-19 is not just impacting our hospital, it's impacting a lot of our vulnerable populations in the community. And so any opportunity we can work together through those partnerships and support one another is a good thing.
Absolutely. And I'd just like to share our fund as well. United Way of Lebanon County recognizes that there might be federal and state relief coming down the pike to help people, but there's folks who have lost jobs who are in need today. And we've also created a fund that 100% of those funds are going to get put back into the community to our nonprofit partners who have seen kind of the uptick in food, assistance and basic needs and other things. So if people want to donate to that as well, certainly on our United Way website, and there's also some text to give information on the bottom of the screen.
Great.
So, yeah.
Brooke, I do have one more update.
Yeah.
So one of the really innovative things that WellSpan has been able to do through this process is ensure that individuals who are experiencing COVID-19, whether they're waiting for a test result to come back or they've had a confirmed positive test, those individuals may still have care needs. So think of the person that is home with mild symptoms, they're self-isolating, but they're out working in their garden and they develop poison ivy. Where does that individual go to get that poison ivy taken care of? WellSpan has created COVID care sites in each of its communities to ensure that those individuals still have access to healthcare needs, but we're able to do it in a social distancing way that keeps the risk minimized for some of our other patients. Here in Lebanon County, 2 sites are opening today. One is at the Tuck Street Pediatric Practice at 850 Tuck Street in Lebanon. That practice will service both pediatric and adult patients. So that's a change in the way they do business, but really designed to take care of those individuals that need care while they're recovering from COVID-19. And then our Myerstown Lab and Imaging Center, which is on 422 or West Lincoln Avenue down in Myerstown, will serve as a location for individuals who may need a chest x-ray or some blood work done, while they're recovering. So I think it's really important to know, we have taken an incredibly proactive approach. Our goal is just to stay ahead of this and make sure that we are maintaining the healthcare needs of our community across the continuum as we all deal with this pandemic challenge. The website is our source of truth. We ask people to check back often because we do update it on a really regular basis as more services become available.
Thank you. That's a really great point. Thinking about those people who are awaiting the test results, where would you go? So I really applaud WellSpan. I feel like your health system has really stepped up to serve the community, not just today, all the time, but especially in response to a really challenging pandemic that we're faced with. So I know at United Way, we really appreciate your partnership as a healthcare system, and we thank you again for your time today.
Oh, it's my pleasure. Thanks for the opportunity.
Absolutely. Thanks.